welcome to this webinar entitled Building an App Library for People Living with Dementia and Their Carers. As I mentioned, there's going to be a few presenters. It's not just me today. So you've got me on the right there, Andy Jeans. I'm Head of Implementations at ORCHA, but we're also going to be joined by Sue, who works at the Social Care Board in Northern Ireland, and Alison as well, who's a person living with dementia, who's give us some first experience. Okay, so what we wanted to do today was give you a little bit of context and then talk about the project in Northern Ireland, some practical examples, and then open up for some questions. And I've had some of them passed to me that you've sent in advance, so we shall do our best to get through as many of those as possible, but we will follow up with any others at the end of the session. Okay, so for context, starting with today's challenges, actually it's starting with today's opportunity really. The health app market has had a boom. So there'll be some stats in here that do and don't surprise you, but all of which add valuable context for the opportunity that we've got at hand when it comes to digital health and apps. So today, 79% of adults own a smartphone, 100%. 16 to 24-year-olds have access to the internet via a smartphone. Won't be surprised that average is 2.5 hours, shocking as it might be. And then specifically relating to health apps, actually it's more like 360,000 health apps now. But 4 million downloads a day, 48% of people have used a health app in one form or another. So a big opportunity there, and actually that translates through to healthcare professionals as well. So we spend a lot of time engaging with healthcare professionals on where they can be using apps to support their patients and support their pathways. And as such, we found that 93% of healthcare professionals believe that apps can make a difference, either be that with improving care or improving efficiencies. But what we found, there are 5 barriers. And I'll talk a little bit about these. Don't want to spend too long on this because, as I say, the main meat of this is going to be around Sue and Alison's experiences. But in terms of the barriers to clinical, to digital health adoption, governance and risk being a big one. So the lack of clarity around appropriate evaluation and governance, regulations and frameworks. Our regulations aren't as stringent as they might be for pharmaceuticals, for other tools as well, and medical devices was the word I was looking for. That leads nicely into the second one of these, which is around trust and safety. So people not knowing which ones they can use safely, which ones they can trust, which ones will give good clinical advice, and which ones will protect any personal data that's input. So if you think about it, what we're asking people to do is engage with apps. We're asking clinicians to go a step further and engage and encourage their patients to use these apps. So obviously, trust and safety are massively important one for them. Thirdly, fourthly, is around the actual practicalities of building digital health and apps into clinical delivery. And none of which at the moment is supported as well as it might be by digital systems and processes. So we're looking in terms of system integration, in terms of prompts and nudges, as there are at the moment, towards more traditional medications and alternative resources. Those aren't yet in place to the same extent for apps. And therefore, obviously, that is making it slightly harder to make it part of care delivery as usual, part of a habit for people for clinicians to think at when they're looking after a patient or a service user. And then lastly, on the end there, return on investment. So evaluation of the impact of apps still remains a challenge. So that's another thing that's inhibiting adoption. So what we are doing a little bit of context of ORCHA as an organisation. ORCHA actually stands for the Organisation for the Review of Care and Health Applications, and that sort of gives you a context for where we fit into this and what we're doing. So as you can imagine from that particular one, we have reviewed over 5,000 apps, looking at those key areas where people are concerned, so primarily clinical assurance, data privacy, user experience, 240 odd criteria these days actually, and reviewing all of those apps. And actually, as it says by the slide title, caution is justified because only 15% of those meet minimum standards. And perhaps not surprisingly, those apps at the top of Google Play and the App Store aren't necessarily the best ones that are available to support a particular need. The last one, just an interesting stat, 65% of apps haven't been updated for more than 18 months. So there are these hundreds of thousands of apps being created and being put on the market, but there are, but in terms of sustainability, in terms of keeping on top of medical advice and technical stability, then obviously that's undermined when these apps aren't updated. So the fact that 65% haven't been updated in 18 months is a problem as well. So what we do, so the last slide on ORCHA before we'll jump into the project with Dementia, is through our app reviews and through our review engine, we're able to provide accreditations for local health economies, for national health departments, etc. And what we do is we then house those reviews onto app libraries, which are essentially comparison websites for reviewed health and care apps, so that people can go on, they can find ones that have been reviewed, and they can find the right one for them with their needs, with the transparency to see that it's been through a rigorous review, and they can make their mind up on what it is that they're looking for. And then in terms of the clinician engagement side, we've created Pro Solutions, which are fundamentally accounts which allow clinicians, healthcare professionals to actually send specific apps straight to a service user's phones. So if you imagine, rather than giving out a flyer or a post-it with a web address on, you're able to just put in your patient, your service user's phone number, email address, and that sends the link to that app straight to their phone, which we're finding to be really, really engaging. Lastly, obviously, we provide a load of support around implementation, around education, around pathway management, and what we refer to as an ORCHA transformation model, which is essentially about really understanding, engaging digital tools and building them into care delivery as standard. And as part of that, there's a job to be done with helping commissioners and deliverers with the commissioning of particular digital tools and apps. So that's the last one on ORCHA, and that's hopefully just provides a bit of context for what we do. We provide app reviews for the NHS and for other countries' review systems as well. But what we'll do now is we'll just move on to our project with the Health and Social Care Board over in Northern Ireland, which we've called Apps for Dementia. And Sue, I can see you're on the line, so if you're happy to join in here, please.
Yes, hello, good morning everybody. Can you hear me all right?
Yeah.
Yeah,
good.
Yes.
Hi. Sorry?
Just saying you sound good.
Yeah, so, yeah, okay, that's good. Good morning everybody. My name is Soo Hun and I work for the Health and Social Care Board in Northern Ireland, and we really are an organisation that commission services with our Health and Social Care Trusts to deliver services to the people of Northern Ireland. I'm here today with Alison Batchelor.
Hello.
Alison is a person living with dementia, so we have her involved at the latter part of the conversation later on to talk about her experience of using the apps. So essentially in Northern Ireland, we have about 20,000 people estimated with dementia, and we anticipate that this figure could triple in 30 years' time. As you all know, the cost of managing dementia, including the cost of dementia care, can be quite substantial, both to the government as the public purse, as well as people who look after people with dementia and people who are living with dementia themselves. And we think that those costs do range between, in UK anyway, and Northern Ireland, between £16,000 per annum to £30,000 per annum. So that's quite substantial. So we, as the public service, need to then be very, very sure that we are able to anticipate and look at services that we provide now and start looking at how we could do things slightly differently in order to manage the increasing cost that is likely to come over the horizon, but also how we can provide better quality of care to people with dementia and their families with the information that we know about dementia. What I want to say is we do have a strategy. Some of that information that we're going to talk through will be based on our dementia services strategy that we have developed. And as part of that strategy as well, we have involved people with dementia and their carers, because we in Northern Ireland we are of the view that co-production and working with people living with dementia are vital, and therefore we have involved them throughout the strategy development process. But you will see as well laterally with the Absolute Dementia Library, we would do the same as well. Next slide, please. Next slide. Yeah, okay. So in terms of the actual Absolute Dementia Library itself, we were able to do this as a result of funding from the Dementia eHealth and Data Analytics Pathfinder program. This is a Pathfinder program that has been benefited from funding from Atlantic Philanthropies, a philanthropic organization, from the Executive Office, our main office of First and Deputy First Minister, and then of the Department of Health. So the initiative has enabled us to encourage us to try and use data and technology to change service, to develop better service, to support people living with dementia, and allow commissioners to plan for the future. So our aims is really to kind of develop services, tools, digital tools, in order to help people living with dementia in terms of enabling them to carry out their day-to-day activities, in order to be able to support their self-management of their condition, in order to provide information and guidance, as well as kind of allowing them to be independent for as long as possible. So what we've done in this case is, whilst we understood some of the challenges about trying to utilize apps, we have been able to work with ORCHA to try and identify apps that we can trust. As we say, we needed to find safe and trusted apps for people to use in order and to meet those categories that I've outlined above. And we're working with ORCHA in part because they fulfill all the criteria that we're looking for in terms of independent evaluation, and they look also at the whole clinical assurance, the data privacy, and the user experience side of the house. So I'm going to now talk about how we actually commission the actual apps library. And I think if you look at the slide, it talks about kind of 4 stages. Really, the stage of scoping out the areas that we wanted to focus on, and then we actually looked at the whole assessment process and how we then built the library and then how we deployed it. So I see, and beside them you see the kind of numbers 1 and 2. So the first phase we went through was really trying to build the library as a capability. So we were very keen to work with our end users, which is the people with dementia carers and healthcare professionals, to identify the categories that apps could be of assistance. So we worked with the healthcare professionals, we worked with the people living with dementia, and they told us things that they needed, the kind of apps that they needed to help them manage their condition. They wanted to have some apps that were going to help them to keep their minds active. And again, the next slide, I'll show you the details of the different categories. Then once we've actually agreed the kind of categories that were important, things that were priorities and matter to the people with dementia and healthcare professional, we then ask ORCHA to do a marketplace research. And what that meant was we set them criteria for how we wanted the different types of apps to be selected, to be shortlisted. And they went up to the marketplace. They found for us about 1,500 apps that were fulfilling the criteria if you type in dementia in the apps library, the various app store. And we wanted to look for specific to dementia apps. We didn't want any other kind of apps that were maybe vaguely useful, but we wanted ones that actually had some insights or provided us insights about dementia. And that gave us 1,500 apps, of which a third, just under a third of them, were actually never reviewed by ORCHA, and that meant that ORCHA was able to sieve out a lot of apps that were not relevant for us. They were able to sieve out apps that were probably even misleading. They were apps that perhaps had said that they could cure dementia, and that was definitely not the kind of apps that we wanted to put onto our library. We also set quite tight criteria for ORCHA. We wanted apps that were over their, and if again later on you will see that ORCHA's apps have a score, so they all have 65%, or anything that's above 65% is considered a category, a green category, and therefore they were the ones that were of the highest. They fulfilled a minimum standard in terms of the clinical assurance, the data privacy, and the usability side. So we wanted any of the apps that were over 65. We also wanted any of the apps that were free at the point of use, and also that were available on both iOS and Android. We then worked with ORCHA to design the site, and again, that was very interactive. We needed the input of, we were very sure that at the very beginning, the onset, that we needed the input of the people with dementia and carers, because if they weren't happy to use the site and the site was not fit for purpose, it didn't have the usability aspect taken into account, we know that they will have challenges or difficulties using the site. Once we have built the library, then we continue to engage with them to kind of develop guidance notes on how a clinician could use the library as well. As I said, the second stage then was obviously to kind of empower people with dementia and carers to build a capacity and incorporate the change management. So we tried then to map the apps to the dementia care pathway so that we would make it easier for healthcare professionals to find the right apps for at the different stages of the pathway. We also, after we shortlisted it, we also worked with end users to identify those apps that were more suitable for their use. So just again, insofar as making sure they were comfortable with the apps that we had selected. We also then obviously incorporated the whole Pro solution. Again, we'll talk a little bit about that later. And we also developed materials for roadshows and demonstrations so that we could go out and tell people about the apps. So the first ones were really building the capability, which is important. The second one is actually then building the capacity to make sure that the people who are going to be using it are equipped to do so. Next slide. And as I said, the various categories were information and guidance, things about to do with communication and memories. We wanted apps because there's evidence that shows that if they keep their mind active, these apps could actually help them to delay or exacerbation of their condition, but also I think provides reassurance for them that they're doing something proactive to improve their memories. And then we also felt that it was important to have apps that help people to stay calm and sleep well, both from the carers and the people with dementia. And finally, we recognize that there are challenges, obviously huge amount of challenges for carers. So we wanted to again develop apps that could provide support to carers. Next slide. And again, this is a very busy slide, and we recognize that. We're going to try and do that better. But this is just, again, demonstrate to you that, the different stages of dementia is from a prevention state, from at the diagnosis, which is the finding out whether it is dementia. Once you have had the diagnosis, we want to encourage you to live well with dementia. And then as they move from stages to the next stage, about how they cope with the changes as the condition progresses, and then at the end of life. So what we're trying to do in this method is to try and give a steer, a suggested pathway for the healthcare professionals, so that when they're at the different stages, they can identify easily which apps will actually help them with the different stages of the condition. And as well, I think for the people with dementia and the carers as well, it is to help them as a guide to understand where we think the apps can help them at the different stages of the condition. Next slide. I think, Andy, I'm handing that back over to you to do a walkthrough about the actual library itself.
Yeah, sounds good. And our decision not to go off onto the internet to do a live demo now seems very, very wise. So what we've got here is a series of screenshots to essentially show you the apps for Dementia site. So as I say, you're going to get the slides, but do feel free to visit the URL to go onto the site and to have a look for yourselves. What you'll see is it's a very easy to use, simple site. There are no moving parts, so this is normally a moving carousel at the bottom of the screen. Colors are all fairly simple, and those were particularly decisions made following feedback from the stakeholders that we involved. So you've got here at the bottom, you'll see that we've put shortcuts through to each of the category areas. So we've broken all of the preferred apps into those areas, and within each one, you can click in, you can see which apps have been approved for those particular areas. You can see what devices that they work on, what scores those apps have got in their reviews. You can see any costing implications, and then if there's one in particular that you're interested in looking at, then you're able to click into it and obviously read more about what it does functionally, see some screenshots, and importantly download, but also share over social media if that's something that you were looking to do. So that's just to give you a quick overview of just how easy it is to use the site to find apps that have been signed off for each of those category areas. So as mentioned, as Soo and I've mentioned, Alison has joined us, and she's going to give us some first-hand feedback. If that's okay, please, Alison.
Yeah, I'm handing over to Alison here.
Hello, good morning, everyone. Yeah, my name is Alison. I live in Dundonald, which is just outside Belfast. I was diagnosed with Alzheimer's in April 17, and before the diagnosis I sort of knew things weren't right, and I knew things weren't going as well as they had been, and then on receiving the diagnosis, as you can imagine, this sort of is very life-changing. You sort of feel life as you know it is over, and you can't see a way forward. And then you slowly come to terms sort of with the diagnosis and realize, you know, this is not going to beat me. I'm going to live as well as I can. And that's why being able to get involved in something like this is vital. It sort of gives you some self-worth. It means your opinions are very much taken into account. And you're still asked for your input into things, which is amazing. And for myself, technology was never a major part at all. And initially I sort of thought, do I use apps at all? And it wasn't until Sue sort of explained to me what apps were and whenever I realized I did. And yet apps frightened me to a degree, because whenever you typed in dementia into a Google search, you were given hundreds of thousands, and you didn't know what was safe and what wasn't safe, and what was reliable and what you should be using and whatever. So again, the library being set up sort of means that you can go in with confidence, knowing that the apps you're going to click on have been assessed, have been checked out, and you know, yes, all of them may not be suitable for you, but you know that they're safe to use and that somebody has looked at them.
Next slide.
Next slide, please. Yeah, one of the first apps I used was LUMOSITY, and I have to say I have really enjoyed using this. This is one I've used right from day one and use it sort of every day. It's set up in a way that whenever you click on it on a daily basis, it gives you 3 different challenges, and they're sort of thrown at you at random, so you don't know what's going to come up the next day. And within that 24-hour period, you can look at the same 3 challenges as many times as you want, completely free of charge, which is brilliant. But part of my dementia is short-term memory. I find it really challenging if somebody tells me something and a couple of minutes later asks me, chances are I won't remember what it was exactly they had said. And some of the challenges within that sort of allows you to sort of focus in on that, you know, so through games you're sort of improving your short-term memory. And you know, challenges that I had started away at the beginning, I was scoring very poorly on, and now my score has really improved, and I do think that it is helping in general living. You know, I can see sort of improvements. It sort of just makes you focus for that few minutes to do the challenge, to sort of play with your short-term memory as it was. And as I say, in real life situations, I definitely have noticed an improvement in that. So this is one I really would recommend. Next slide, please. Yeah, whenever I was diagnosed, the medication I was put on, one of the side effects was absolutely horrendous nightmares. And it got to the stage that you sort of dreaded going to sleep because you knew you were going to be wakened up with this terrifying scenario that was going on that appeared to be so real and you know, as if you were really in the situation. And one of the apps I had downloaded was AMBIO, and I have found with using that before I would go to sleep, it just seems to put you into that sort of calmness as you drift off. And I would find on the nights that I would forget to use it, you know, maybe be extremely tired and get into bed and sort of fall asleep before I would play it, that would be the nights traditionally. Now still I would have the nightmares. Now some nights, even with using the AMBIO, I still would, but definitely on the nights I use it, that is much less. And as I say, it's the sort of signs that even in the room with my husband in it, you know, it doesn't annoy him either. You know, you can sort of choose the sounds that suit yourself, and again, I find it really beneficial. Next slide, please. Now, this particular app has been invaluable. As I say, part of my condition would be disorientated and at times sort of going out and sort of losing where I am, and you know, and not able to sort of focus myself to sort of to see exactly where I'm at and where I need to go and what I need to do. So this is something that gives me a massive reassurance. It means whenever I would go out, my husband, my son and my daughter have this on their phones as well, and it means they know they can find me, and I sort of know with reassurance that you know, that if I am lost or whatever, it just gives me the reassurance I need, and also it reassures my family as well, and people who care for me that I'm okay. So thank you very much.
Thank you very much, Alison. Handing back over to me, I think. So I think that was very useful. I think you find from getting a really good insight from Alison in terms from a user perspective and how she has found the different types of apps being of use to her. I'm going to touch on now slightly back onto the actual library itself, and one of the features that we have on the library, which we have decided to use, is the actual professional access, the pro accounts. And again, this allows our healthcare, again, we wanted to make it really easy for our healthcare professional to use They're very busy people, as you know, lots on. So, and our apps needs to be working seamlessly and be able to be embedded in their care delivery easily. So we've given them accounts that they can sort of use to search the apps. There are not many, so that's easy enough to do. They can favorite some of their preferred apps, so they know some of the apps that are being used and have had feedback, positive feedback from users. They can favorite those, and then they can use that obviously to recommend to their patients and carers. And one of the ways that they can do is that they can actually collect the mobile number or the email and be able to send the links directly. Next page, please. So you can see there is it's quite small, but essentially at the bottom right, you have a button that says recommend app. And if they click the recommend app, then they can input the phone number and details. And as you can see from the bottom slide, phone number or email address. And then whoever it is, whether it's the person who's able to download the app themselves, whether it's the person who's living in dementia or the family member or carer, they would then receive the link. And when they click the link, it will take them directly to the page itself. Then they can read the details, or they can then click the download app, and it will then obviously download onto the phone or the tablet itself. Next page. So having talked about the actual library, and now that we've actually launched it, so we obviously also needed to develop additional information, and I'll just touch very, very briefly on the kind of collateral or messaging tools that we've developed. We've developed leaflets which we think are useful, that we can put in GP surgeries, that we can hand out to family and carers during the clinics. We're also hoping to, we've also done a whole lot of training for our healthcare professionals, and we want them to be able to understand how they can use, how to have conversations. So all of that training is going to be part of a booklet that we're going to share. The booklet will have how they can get on to, how they can guide their patients and family members how to download apps. They will have individual details about the individual apps so that they can talk it through with the people with dementia and the carers during a consultation session. It will have also, how kind of questions or helpful tips on how they can approach conversations about apps with people who may be, as Alison indicated earlier, not be familiar with digital, but not even realize that they're using apps, but actually are using them, just think that they're using it, to talk to family members and stuff. And then we've done a lot of promotion as well. Next slide. And again, the whole co-production approach has been really, really important for us. So to date, we have obviously run all the workshop to engage with service user in the development, and as well as promoting the site. We've delivered the training with more than 70 healthcare professionals now have set up accounts so that they can recommend apps. We have had more than 100 apps recommendations, probably heading up to maybe 200. And we are wanting the healthcare professional to be able to embed this as part of their care delivery. Quite importantly, our next stages are to really do more to enable people in dementia charities to also, because they engage with people with dementia and they have a huge membership and they are supporting their members. So some of that information and guidance, some of the self-care tips, the things that Alison has talked about, is really, really important for them to be able to talk to their members. We want to be able to, kind of make it more regular. We're going to evaluate, obviously, the rollout of this project, and then we are going to see whether the library is applicable to others as well, who could be benefiting from this sort of work, for example, in the area of mental health or any other long-term condition. And also, quite importantly, I think the library now allows us to have a central resource of digital apps that we could then not only make recommendation, but also in the future identify opportunities or gaps of things that we might want to be able to put onto the library, which may be apps that are not available in the marketplace or not good or sound apps that we may need to commission ourselves or commission or work with others to commission. So that's a really important thing for us as a future development. We are already identifying 2 areas of apps that we're going to potentially develop, building on the whole principle of clinical assurance, data privacy, usability. We're developing one app that is going to help us to manage challenging or complex behavior when people reach a certain stage of the dementia, and trying to help carers to cope with those behaviors. That's coming in March. And another reminiscence app that we've had clinical evidence that it's worked really well to bond with to develop bonds with family members. So that's another app that we're going to be putting onto the library come March. I think that's about it all from me. Next slide. Andy, over to you.
Yes, so fantastic. Thank you very much indeed, Sue and Alison. What we're going to do now is just give you an opportunity to add any questions. You've got a questions option on your control panel, so add any questions. We've already had a few. We had a few sent through in advance, so whilst you're doing that, we shall make a start on some of the ones we've already had through. I mean, we've already answered a couple of them. So, are you looking to add more apps? Yes, absolutely. As Sue mentioned before, we have a process for both reviewing and adding more, but also the two apps in particular that Sue mentioned just then. There was a question here about the balance between iOS and Android apps. In the main, what we've tried to do is review apps where they are available on both platforms. Where that hasn't been possible, what we've looked to do is to add the extra platform within a similar functioning app to make sure that everyone gets a facility to use both. In terms of, there's a couple of practical questions here. So how would they get hold of some of the printed collateral, Sue?
We are hoping to put a resource together that will, certainly from a Northern Ireland perspective, because again, that you can use them, but you know, it's more suitable for the Northern Ireland context. We are hoping to put them onto a central resource that we will then, an online resource that we can then share with people, and then they can come and view the progress. They can view some of the slides that we've done about the actual library itself, some of the promotional material, and some of the comms material will be on that, yes. Or either, if not, then you can email at appsfordementia@hscni.net, and you can send that email address when you send up the slides to people later on.
Fantastic. We've got loads. We're not going to manage to get through all of them, but we'll keep going. So there's a practical question here about the actual process of recommendation and how people prefer to receive recommendations, and this is actually quite an interesting one. I personally had a hypothesis that an email that came with a clinician's name would be preferable, but actually we had a really good conversation with this. About this, and actually a text message, whilst sent within a session, i.e. so it's received within a session, was more preferable still, so that actually you had the context. The worst case scenario, I think, it would have been the text message recommendation sent after a session, i.e. once the person living with dementia has left, and therefore there's a chance that with a lack of context that the text might be missed or might be misunderstood. So that's one of the questions. So there's been a couple of questions with regards to central funding. So there's a question about apps that come at a cost, and if there's any intention to centrally fund those, and also one around if people are using their own devices. So I'll quickly cover what's on the site, and then Sue, if you have a thought on behalf of what your thinking is. In terms of what's on the site, all the apps that are on there have been put on there because the free functionality, the free to use functionality has been tested, has been used, and has been shown to deliver value to the people that have tested. Where there is an option, so there is an option with some of the apps to sign up for subscriptions or to access premium functionality. At the moment, that is at a user's discretion. Because there is enough functionality there for them to see benefit through the free content, there is currently no need for you to sign up to anything in addition. Anything you wanted to add, Sue?
Yeah, I think for the apps on the library, I think I had mentioned it earlier that we've also ensured that the criteria for the apps to go onto the library is that they all have to be free at the point of use. They may have in-app purchases, but they have to be free at the point of use. I recognize that might be few and far between, but then at the first instance, that's what we're looking at. Obviously, as the need or the library is being used more widely, we will see other people asking for perhaps other types of apps that are not currently available on the library. And again, we will then explore with ORCHA what the availability of those apps are, whether they are already ones that are developed in the marketplace that we can actually utilize. And then that might be a cost involved in it, but we will then have the discussions with people with dementia, with healthcare professionals about the ability for people and willingness to pay for certain types of apps. That will obviously be dependent on the apps itself, be dependent on the model of payment. Again, if payment is something that we are looking to do in the future, I think our preference would be a one-off payment rather than on a subscription basis, partly because we don't know how long some of the apps are going to be used, so subscription basis is not really going to be reflective of the usage that we don't know, that we're not aware of. And then last but not least, I think having the library, as I've said, allows us to see maybe there are apps that are actually not available, and then if we feel that, again, that the evidence is there, that a digital tool is something that we should be utilizing, then I think for a case to be made for that app to be either developed or commissioned and made available to the users or healthcare professional, it's much easier than, because we can then demonstrate that there is a need, we can demonstrate that the actual types of app is not available in the marketplace, and therefore to build a case to seek for additional funding to develop that app is then a much more, you build a more robust case for that to happen.
Fantastic. And there's a couple of questions specifically relating to ORCHA. So something about data use. So when you get the slides and you visit the Apps for Dementia site, if you scroll down to the bottom, you'll see ORCHA's privacy policy and terms and conditions. So that will be able to shed a light on that. Similarly, from the site, you'll be able to read more about the ORCHA review process, or if you give us a quick Google, you'll be able to review and read more about what we review for, some of the questions that we ask, and the